Professor Montgomery, we've all heard the news that Prince Charles has now tested positive for coronavirus. How effectively is that concentrating people's minds over there on the need to keep following the government restrictions?
I'm not sure that in itself is. I think the most impactful thing probably has been some of the messaging coming out from sick patients. So now we're getting TV footage here from yesterday from a mother whose 21-year-old daughter, previously completely fit and well, has died of the disease, and footage of young pregnant women in hospital with severe respiratory distress problems. So I think those are most likely to be the things that are impactful when people realise it might be them.
And what is the situation in Britain at the moment regarding the hospital's capacity to meet the demand for treatment?
Well, we're trying, and at the moment we're largely coping, but we're on this exponential function of cases. So to put simply, once one's infected, it takes about 6 days to develop symptoms, and one can be spreading the disease for between 4 and 6 days at that time. And to become critically unwell, people tend to present at between 6 and 10 days of illness. So this massive rise that you're getting in Australia and we've had here will be followed sometimes 6 to 10 days down the pipeline by the same exponential rise in hospitalised cases and intensive care cases. And that's what we're hitting about now. We're told by our Department of Health that London might run out of intensive care beds by the 28th. That's 2 days' time. Because of this exponential function, which I can explain if you're interested about how that works.
Please do.
Well, put simply, if you get ordinary flu, you pass that on average to 1.4 people, if you could do such a thing, which means that if they then pass it on to their 1.4 each, by the time 10 cycles of infection have happened, you have been responsible for 14 cases of flu, which is pretty bad. If for coronavirus at its worst, you can infect 3 people, by the time you get to the 10th cycle, that 10th wave has infected another 59,000 people on its own. And overall, you have been responsible for 78,000 cases of this disease. Now, if only 10% of those need to go to hospital and half of those to an intensive care unit, you can do your own maths. Britain only had 1,000 adult intensive care beds a few weeks ago, and we're looking as if we're going to have 17,000 intensive care cases within the next few weeks to contend with. So this is a tsunami. We're in uncharted territory. We're coping at the moment, but it'll be a test of our resilience, really, about how we all pull together to get through this.
In your view, should Britain have gone down into the very strict lockdown phase sooner?
I don't know. It's very easy with retrospect to criticise or to say, well, actually, now knowing what we currently know, would we have done things differently? Well, I guess almost certainly, but that's my world in intensive care. I often have to make a decision, which a patient sometimes dies, and I look back and think, well, maybe they'd have lived if I'd made a different decision, but it doesn't necessarily make the decision at the time the wrong one.
What's your best advice to people here in Australia about what they need to do to try to stop this becoming an even more dire situation?
Please don't be as foolish as a small minority of the British public. The British public have been amazing here and have backed us all the way, but there are still people going out picnicking, going to beaches, having parties, thinking that for them it doesn't much matter because this will be a mild disease. And you know what? They're right. For most people, they won't even notice they've got it. And if they do get it, it won't be bad. But this isn't about you. It's about other people. If you spread this and you spread it that 3 times without even knowing you're doing it, 10 cycles later, you have been responsible potentially for 7,000 hospitalised cases, and you will have blood on your hands. So please, 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 heed the advice your government's giving you. Stay at home. If you have to go out, stay 2 metres away from everyone else. This is droplet spread. Very, very hard to catch at a greater distance than that. Wash your hands before you leave, in case you're an asymptomatic carrier. Wash your hands when you come back in, and do that rigorously all the time. This will be hard, but if you do this, you can, as we talk about, flatten the curve. This is about turning a tsunami into a long, slow roller. The same number of people may get infected, but if the tsunami doesn't happen, your health services have a much better chance to cope. If they can't cope, they can't help you survive if you get critically ill.
Professor Montgomery, thank you very much for your time.
It's my pleasure. Thanks for having me.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.